Welcome to my presentation on critiquing the response to the Ebola epidemic through a One Health perspective. Aim of the presentation: to explore the timeline and origin of Ebola virus disease of 2014 to 2016, critique the international response to Ebola virus disease in 2014 to 16, identify lessons learned from the response for future preparedness. Methods used. The method adopted for the critique of the selected topic is through literature review. An integrated literature review will generate evidence and findings which can be used for prevention and management of similar outbreaks in future. Literature review is the best way of understanding the effectiveness of implemented strategies and also to identify what could have been done differently. The entire critique of the global response to Ebola virus disease is conducted from a One Health perspective. Ebola virus disease outbreak of 2014 to 2016. Ebola virus disease was first identified in Africa in 1976, near the Ebola River, in what's now the Democratic Republic of Congo. The outbreak in West Africa in 2014 to 16 was a major threat to mankind. On March 23, 2014, the World Health Organization reported cases of Ebola virus disease in the forested rural region of southeastern Guinea. The identification of these early cases marked the beginning of the West Africa Ebola epidemic, the largest in history. The initial case or index patient was reported in December 2013. An 18-month-old boy from a small village in Guinea is believed to have been infected by bats. What is Ebola virus disease? Ebola virus disease is a deadly disease caused by a group of viruses within the genus Ebola virus. Ebola virus disease most commonly affects people and non-human primates such as monkeys, gorillas, and chimpanzees. Transmission. The virus first spreads to people through direct contact with the blood, body fluids, and tissues of animals. The disease then spreads to other people through direct contact with body fluid of a person who is sick or has died from Ebola virus disease. Why is Ebola outbreak of 2014 to 16 significant? This outbreak is unique with its geographical distribution and multi-country spread. This was the largest Ebola outbreak in history. This outbreak was also associated with significant fatality and also social and economic impacts. Moreover, evaluation of this response is useful for future preparedness. Aim of the presentation: to explore the timeline and origin of Ebola virus disease of 2014 to 2016, critique the international response to Ebola virus disease in 2014 to 16, identify lessons learned from the response for future preparedness. Let's look at this outbreak from a One Health perspective. What's One Health? American Veterinary Medical Association defined One Health as an integrated effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and the environment. The Ebola outbreak of 2013 to 15, which started in Guinea and raised the spectra of pandemic spread, provides a useful lens through which One Health can be analyzed. Analysis of real-time response to the outbreak highlight many challenges in modeling not only the environmental facilitation, zoonosis, and human spread of Ebola, but also the related dynamics of other disease. Example, through interruption of vaccination programs. This is called a One Health triad. When people, animals, and environment are put together, they make up the One Health triad. The One Health triad shows how the health of people, animals, and the environment are linked to one another. With One Health being a worldwide concept, it makes it easier to advance healthcare in the 21st century. Ebola virus disease through One Health. The One Health concept allows for an emerging infectious disease such as the Ebola epidemic to be viewed and addressed in a tripartite manner. The factors colored pink in the diagram are the human factors. The blue section is the animals, and environmental factors are colored green, and they are considered in the forecast and control of diseases. This is a poster by the Center for Disease Control and Prevention applying the principles of infection control in response to Ebola. There are three major headings: identify, isolate, and inform. So identifying the risk factors and identifying the symptoms the major symptoms are fever, muscle pain, weakness, fatigue, diarrhea, and vomiting, and also assessing if the patient has exposure to the disease. And if the assessment indicates possible Ebola virus infection, then the next step is to isolate. Isolate the patient in a private room with a private bathroom or bedside commode, wear appropriate PPEs, and then it goes up all the way up to follow CDC guidelines for cleaning and disinfecting and managing waste. So after isolation, the another major heading is inform. Alert others, including public health authorities. Response to Ebola virus disease. The Ebola virus response has a 5-point strategy: stop the outbreak, treat the infected, ensure essential services, preserve stability, and prevent further outbreaks. This diagram shows the CDC's response to Ebola virus outbreak. It is showing different strategies implemented by CDC in response to the outbreak in order to prevent the spread of the disease and also to control the disease. It includes traveling restrictions, early response to Ebola virus disease from Guinea. CDC's Emergency Operations Center was activated. Testing centers were established. CDC issued travel warnings for Western Africa, and CDC also conducted micro-planning workshops with country leaders held in Liberia. And CDC implements enhanced screening at airports, new tracking program for people coming from countries with Ebola outbreak. And the CDC worked with states to improve hospital readiness. And CDC recommends reduced screening for passengers from Liberia by the end of June. And deployment of staff members and rapid isolation and treatment of Ebola. So CDC was contributing to all these in relation to the Ebola virus outbreak of 2014 to 2015. The diagram shows the response of UN to Ebola outbreak. The entire UN system, the governments of the affected countries, partners, and NGOs are mobilized to help the region to reach and remain at 0 cases and support long-term recovery. The Ebola virus response is highly complex. It requires the continuous effort by hundreds of different kinds of organizations and thousands of people to implement it quickly, effectively, and efficiently. Countries large and small have stepped up to provide doctors, mobile clinics, and funding. These efforts show the immense value of international cooperation in disease prevention. What is Ebola virus disease? Ebola virus disease is a deadly disease caused by a group of viruses within the genus Ebola virus. Let's critique the response to Ebola virus disease of 2014 to 16. In the African context, generally speaking, a number of factors could determine the rapid spread of Ebola. These factors may include social and economic factors, poverty, malnutrition, poor sanitation, individual health status, health literacy, and other education related factors. Ebola is an emergency that requires quick and urgent reactions. Many Western African countries, the lack of rapid response was adversely affecting the spread of the disease. In addition, many of these countries had relaxed immigration policies which worsened the spread across the regional boundaries, apart from common vector agent migration. Apprehension of Ebola led to misconceptions in some parts of the country. The fear of Ebola and poor health education resulted in various health problems and challenges, down to self-prescribed preventive measures such as drinking and bathing in salty water. These indicate the lack of knowledge. An important determinant of the rapid extensive spread of Ebola virus in West Africa was the occurrence of the infection in medical setting. Such infections, otherwise termed as nosocomial infections, were largely due to failure in established procedures of infection control and breach of standard barrier precautions. Moreover, social factors such as culture, tradition, and occupational hazard also played a significant role in the spread of 2014-16 Ebola outbreak in West Africa. Internationally, different agencies worked together in response of the outbreak. The infection threatened health providers in international gateway cities, and contingencies for satellite spread burdened global healthcare infrastructure. What are the gaps that would be addressed by a One Health approach to a future outbreak? The domestic and international response to the recent Ebola crisis was complex and multimodal. It included the implementation of public health, public awareness, and clinical intervention measures. As a result of these measures, the outbreak was eventually contained. However, the crisis revealed several significant gaps in disease awareness and management that can be addressed in response to future outbreak of emerging diseases. These gaps include the following: insufficient monitoring and ecological modeling of zoonotic infections and transmission, insufficient system of rapid dissemination and community education about the ecological aspect of disease outbreak and management, and insufficient resources committed to enhancing food security to limit environmental encroachment and exposure to zoonotic disease in the wild. Let's see how these gaps can be filled. First, it's not clear exactly how humans were initially exposed to Ebola, but available information suggests that it could have been through handling of infected fruit bats. Despite increased knowledge of cultural practices and bat behavior in Ebola epidemic regions, more studies are needed to generate the data required to create computational models that will accurately predict outbreaks. Evidence of asymptomatic infection in fruit bats suggests that these mammals may be natural Ebola reservoirs, but there is a need to empirically identify ecological drivers of virus spillover and how these drivers influence infection of other susceptible hosts, including humans. Secondly, to address the deficiencies in information dissemination and community education about the ecological aspect of Ebola outbreak, a coordinated response is required. Studies have revealed striking deficiencies in community understanding of modes and ecological drivers of Ebola transmission, as well as cause and effective interventions for Ebola virus disease. Thirdly, resources must be committed to ensure that unstable food security does not increase opportunities for humans to encounter viral reservoirs. Hunger drives humans into more remote forests where alternative food sources, including primate bushmeat, are available. Although bat saliva and feces have been implicated in Ebola virus transmission to primates, predation of bats by monkeys has also been documented and could contribute to non-human primate infection. Let's conclude the topic by summarizing the key aspects. The outbreak was a major threat to the mankind. Local and international responses were aimed at stopping the spread of the disease and managing the infected individuals. Gaps in responses were identified through a One Health approach for better preparedness for similar occurrences in future. One Health is the way forward.